Hi, Dr. Mark here at Natural Health. We're going to start a topic series, and this is the first one in this group. Just kind of going over some of the most common topics, most common problems people have, and a quick explanation of that, how we look at it. Now, again, we're looking at it from a holistic point of view. We're looking at it from how the body sees it. We're not looking at it chasing the symptom perspective. So, for instance, this first topic is called hiatal hernia and digestion issues. And so, normally when you go into the MDs with digestive issues, you're probably being put on a proton pump inhibitor, especially people that are having gastric reflux. They think there's too much stomach acid there. And so they're using a proton pump inhibitor to stop the body's ability to make its own stomach acid. And of course, the symptoms are better because there's less acid. The problem is it makes the condition worse. So we're looking at it, most people after the age of 35, even 40, start to make less stomach acid. And so when they eat food, especially if they eat the wrong combinations, which we can talk about in other videos, but we're looking at problems with the body's ability to make the right kind of stomach acid so you digest your food correctly. It doesn't digest, it sits in the gut and bubbles and churns and basically putrefies. And that acid from the putrefaction is what causes the gastric reflux and the irritation there. The body knows how to handle hydrochloric acid, which is the acid it normally makes, but it doesn't know how to handle all these other acids of putrefaction rotting there. So when that happens, then the pH is not correct, the gastric opening does not open, that the valve there, so the stomach just stays full, you bloat up. If that happens long enough, actually mechanically, you're pushing on the diaphragm, and that causes that hiatal hernia or hiatus hernia there, which is the problem where the esophagus comes through the diaphragm. There's a hole there called the cardiac sphincter. Normally that closes down to hold the stomach contents in the stomach. If you bloat, you keep pushing that up, pushing that up, pushing it open, and actually eventually, because of all the pressure, cause a hernia there. And so what we're trying to do, again, with our adjusting techniques is pull that down, try to get the body to re-heal that. But beyond that, you have to fix the digestion. You get the body, get the person eating the correct kind of foods in the correct combinations, and then get the stomach acid up where it needs to be so the body can produce hydrochloric acid, which again is important for all the different openings and valves in the stomach and the digestive system to work correctly. And the body knows how to, produce bile to offset the stomach acid, and that's how the intestines work. All kind of things going on there with the pH. So a very important topic of digestion and hiatal hernia. And again, how we figure all that out, of course, is with the nutrition response testing technique to ask that body what it needs to work correctly, not trying to chase the symptom, but actually get to underlying causes.